Hi, my name is Tanisha Cajas and I'm gonna talk about endometriosis complications. Definition. Endometriosis is an often painful disorder in which the tissue-like tissue that normally lines the inside of the uterus, the endometrium, grows outside the uterus. Endometriosis most commonly affects the ovaries, fallopian tubes, and the tissue that lines the pelvis. The hormonal changes in your menstrual cycle affect the endometrial tissue out of place, causing the area to become inflamed and painful. This means that the tissue will grow, thicken, and decompose. Applications in medicine. Pelvic pain is the most common symptom of endometriosis. It can cause pain in the lower abdomen before and during menstruation, heavy menstrual bleeding or bleeding between periods, sterility, or pain after intercourse. Endometriosis has no cure, but its symptoms can be managed. Medical and surgical options are available to help reduce your symptoms and manage any possible complications. Pros and cons. Pros. Endometriosis has no cure. Taking supplemental hormones can sometimes relieve pain and stop the progression of endometriosis. Hormone therapy helps your body regulate hormonal changes that promote tissue growth that occurs when you have endometriosis. Hormonal contraceptives decrease fertility by preventing monthly growth and accumulation of endometrial tissue. Cons. Women cannot get pregnant. Cancer. Issue applied in Ecuador. 1 in 10 women has pathology and 50% of them cannot conceive. In 2017 in Ecuador, 1,027 new cases were diagnosed. There is no definitive cure in the country. An average of 2.8 women are diagnosed every day. In 2016, 1,112 new cases were treated in the Ecuadorian public system, of which 654 attended regular control appointments.
The endometrium is the inside lining of the uterus. An endometrial biopsy is the removal of a sample of tissue from the endometrium for testing. A biopsy may be done to screen for cancer or precancerous cells, to determine the cause of irregular bleeding, or to investigate fertility problems. This procedure can also check for infections and monitor the effectiveness of certain medications. An endometrial biopsy can be done in your doctor's office in 10 to 15 minutes without the use of a sedative. Your doctor will first do a manual exam to determine the position of your uterus and then place a speculum in your vagina to open it up and keep it open so the cervix is visible. Your doctor may use another instrument called a tenaculum to grasp the cervix and hold it steady during the procedure. Your doctor will then pass a long, thin, flexible tube called a pipelle through your vagina and cervix and into your uterus. The pipelle is equipped with a piston-like device that creates suction when pulled. Your doctor will spin the pipelle and move it up and down in the uterus while suctioning up an adequate sample of endometrial tissue. Then remove the pipelle and place its contents in a container. Your doctor will complete the procedure by removing the tenaculum and speculum. After the biopsy, some patients are able to sit up immediately and feel minimal cramping. Others, who may feel some dizziness, will be asked to lie still for about 10 to 15 minutes before being released. An anti-inflammatory medication, such as ibuprofen or naproxen, is often prescribed to minimize any menstrual-like cramping or discomfort. Your doctor will send the sample to the lab for testing. Results may be given to you by telephone or during a follow-up appointment with your physician.
Hello, I am Dr. Nupur Sood. I am an obstetrician, gynecologist and a gynec laparoscopic surgeon. I have been practicing for the last 10 years and presently I am working at Bomanahalli and Hosur Road in Bangalore, India. So there are two major concerns with endometriosis. One aspect is that when it is causing the severe pain and the dysmenorrhea, which we call, as well as the bleeding disturbances, which may require to, when it becomes a complicated case, that is, it's not responding to the medical treatments, we have to land up having a surgery for it, which would involve the removal of the cyst in the ovary, the diseased cyst. It may involve removing a part of the uterus, or in fact, in most of the cases, they'll end up having the complete uterus being removed itself. The other aspect is that when you're having this dysmenorrhea, but you need to conceive also, so we need to preserve the uterus. Now, if we need to preserve the uterus, we need to do some sort of treatment where we can solve both the issues. and especially when you are having a difficulty to conceive, it requires a certain kind of a different surgery where only the disease part of the ovary and the uterus will be removed. The rest of it would be managed with a certain type of injectables and medical therapy which need to be taken for a certain period of time before again you can restore back the normal functioning of the uterus and the ovaries and they can conceive. So these complications are very severe with endometriosis, and it should be picked up early and treated early so that it does not spread and cause such extensive damage within the system.
Conclusion: endometriosis is a chronic condition with no cure. We still don't understand what causes it. But this does not mean that the condition has to affect your daily life. Effective treatments are available to control pain and fertility problems, such as medication, hormone therapy, and surgery. Endometriosis symptoms usually improve after menopause. Thanks for watching.